Move into our 8:35 item, our COVID-19 update with Public Health Director Kathy McKay and Nursing Director Jamie, and we also have Becky with us again this morning. Good morning.
Okay, I'll start with our active cases this week. As you can see, the number of active cases just went down slightly, not a big dip, but 39 cases less in Clay County. However, in Minnesota, we still see the numbers going up, so 2,500 more than we saw last week. In Cass County, the numbers have dipped a little bit. Still elevated, but have there's a little bit of a decrease in the Cass County numbers, and the active cases in North Dakota have decreased a little bit. Now, as we look at the active cases, it's always fluid, and as Becky always talks about, is it's trying to catch up with the cases after they go through the process. So they're they can go up and down, particularly with viruses. But the concern, of course, is as we head into the winter months, this is a respiratory virus, so it's just more likely to spread. So a lot of the cases across the United States, the northern states of the U.S. are clearly still in high transmission. And so that's certainly a concern, especially with some of the holidays up and coming as well. Cases by age, we see that the 5 to 9-year-olds are still the high numbers of children. But we're also seeing the uptick in the 30 to 49 age groups as well. The total cases cumulatively by age, so this is the reported cases across the pandemic. So we're at 11,817 cases for the entire pandemic, and through the pandemic, it's the 20 to 24 range that's the highest. This is cases per week, so from July to current. So there's been an upward trend since the beginning of August, and so for the week of the 14th through the 20th, there's 299 cases so far. The week before, we had 347 reported cases, so again, slightly down from last week. And then the overview of the cases, again, throughout the pandemic, the numbers started March of 2020, and so you can see the last bars, the 299. No indication about, we were hoping to reach a peak by now in this fourth wave, but again, with the virus, it's been so unpredictable that we're still in that fourth wave, which is way longer than a typical wave. So we're not sure that we've reached a peak yet. That is the unknown. And then we'll go to Becky.
Good morning. So this is the CDC graph that they put out on a weekly basis, so just the level of community transmission. So as we can see, Clay County and all of Minnesota remains in that high level of community transmission. And so these numbers reflect case numbers between November 14th and the 20th. This graph depicts Clay County deaths reported by week. Unfortunately, we've had 2 additional Clay County residents that have died since we reported last week. So our total number of deaths throughout the pandemic is at 102. And then this graph again is the number of COVID hospital admissions per week for Clay County residents. We are seeing another increase in hospitalizations, which is typical, after we see a surge of cases. So for the week of 11/7, we had 15 admissions and 9 admissions reported so far for last week. Again, that number can go up as the data comes through and gets updated. It is concerning that we haven't seen this level of hospital admissions since last November. And then this is the hospital capacity for our local healthcare systems in Fargo. At the time of this report, Essentia had 3 staffed ICU beds for adults and 0 staffed pediatric ICU beds. Sanford had 3 adult ICU beds and 1 pediatric ICU bed available. And the Fargo VA did not have any adult ICU beds available at the time of this report. Statewide, there was 19 available adult ICU beds and 7 pediatric ICU beds. And then this is this slide shows statewide hospitalization data for North Dakota as of yesterday. So there are currently 163 hospitalized due to COVID, with 21 in the ICU. So this is an increase in the number of patients in the ICU from last week when there were 16. The chart in the middle shows current hospitalizations broken down by age. So currently there's 4 pediatric admissions. And then the chart on the right again just shows the age groups of total admissions throughout the pandemic. And this is the updated graphic from the Sanford Healthcare system. We feel a little bit like a broken record every week showing this, but again, we continue to see the same trend. The red people represent those that are not vaccinated, the white represent those that are. The overwhelming majority of hospitalized cases continue to be among the unvaccinated. So 44 of the 47 patients currently on ventilators are not vaccinated. And then this is the breakthrough data that's put out by the Minnesota Department of Health every week. Again, seeing the same trends. Our breakthrough cases are going up a little bit per week, which we expect. So 2.569% of those that are fully vaccinated have wound up testing positive for COVID. Breakthrough hospitalizations continue to be low at 0.111%, and breakthrough deaths continue to be even lower at 0.019%.
Jamie?
Good morning. Okay, looking at the statewide vaccine data as of November 18th, for those 5 and up now, we're looking at people with at least 1 dose of vaccine, 69% across Minnesota, and looking at those who've completed the series at 64. So we're going backwards because we're adding a lower age group, and that's what we're seeing. And we did add for the first time here, we have the number of people in the state that have had the 3rd and the booster doses administered. So 816,163 people have had that 3rd dose or booster dose. And if you remember, that 3rd dose early on was for those with compromised immune systems, so they're in there as well. And then just the breakdown of the population by age. So for the 5 to 11-year-olds, we're at 16% with that 1st dose and 0 for the 2nd. Because of the approval, and then the 12 to 15, 60%. And then again, what we're seeing is pretty consistently across Minnesota, the 96% of the 65 and over have had that 1st dose, and then 93% have completed the series, and hopefully a very large percentage of them have also had their booster dose as well. And then the total population down at the bottom, 65% have had 1 dose and 60% have completed that series. So that's slowly but surely making progress with those vaccines. And then we'll look at Clay County data. So Clay County Public Health to date has administered 17,266 doses. Last week at our clinic, we had 454 doses. We continue to offer the 1st and 2nd doses, very minimal 1st and 2nd doses. I think we'd had just 1 of the 1st doses, but continue to offer those. And we had the children's vaccine available. We continue to hold evening clinics for families. This week, we have a clinic today, or actually we have 2 clinics today. We'll have just 1 because of Thanksgiving. But we have this morning from 10 to 2, we have Moderna 1st and 2nd doses and booster doses available. The Pfizer 1st and 2nd doses for 12 years and older, and then the booster doses for 18 and older. And, you know, although Minnesota Department of Health has really encouraged us not to turn anyone away, previously it was about people that had chronic health conditions or had an exposure in the workplace. But really, they've said anyone who is 18 and over could have that vaccine, but now that door has officially been opened, so anyone 18 or over is eligible for their booster as long as the time frame of the 6 months for Moderna and Pfizer or the 2 months for the Johnson & Johnson. So hoping that we'll get lots of people to sign up for that one. And then we kind of split it up, and we're going to do an evening clinic again from 3 to 6, inviting our families to come in with their kids. So Pfizer first doses, 5 to 11-year-olds. Pfizer first and second doses for those 12 and older, and then Pfizer booster doses 18 years and older this afternoon. Both of those clinics are in the Family Service Center, and then we have already scheduled 3 clinics for next week as well. So, any questions about that?
Questions? Yes, Commissioner Abinger.
Yeah, we've got the Pfizer vaccine. If somebody needs a booster and they've had Moderna or J&J, the Pfizer would be adequate.
Yes, you can mix and match those if you've got your first or second doses and your Pfizer doses. We do not have any Johnson & Johnson vaccine with us anymore at this point. We did last week, but we don't this week. But you could have either the Pfizer or Moderna if you've had a first and second dose.
Hey, thanks.
Thank you.
Just going to point out here, I try to look for some positives and a lot of negatives here. And, you know, the fact that prior to vaccines being available, we had 92 deaths in Clay County. Since that vaccine's been available, that number has dropped to 10. That, to me, that's certainly another indication for those who may be questioning that the vaccine is working. And when you compare that chart to the charts of number of cases, the same thing applies. You see a lowering of the numbers. You know, I mean, it's everybody's individual choice to whether they get the vaccine or not, but there certainly seems to be very good data that supports what you folks have been talking about for quite some time. So, Commissioner Cayley, I saw your hand up first.
Another thing I noticed when I was looking at the data today is our total cases were 11,817, so pretty close to 12,000. And if you look at the population of our county, that means about 1 in 5 people in our county has had COVID so far. And that seems really high, but that also leaves 4 out of 5 that haven't had it yet. So yes, that vaccine is still important to protect that 4 out of 5 or those that could get reinfected.
Commissioner Ebinger.
Yep, I'm going to restate the obvious, but Thanksgiving this week, Christmas coming up, a lot of travel. If you've been to an airport in the last 3 months, you know it's like spending hours in an elevator. If people are going to get together, if they're going to get together as families, if they're going to travel, if any of this, get in and get a shot. Get a booster if you've already had your vaccines. If not, just get the vaccine. It's not a political statement. It's taking your health and the health of people around you into consideration. And it's supported by science. So I don't want to get preachy, but it's just such an obvious thing you can do and people around here will load up sandbags and break their backs for a week to take care of their neighbors. You can go get a shot in the arm. It's just what you do.
All right, did you want to touch on this, or have we touched on
Oh,
this?
sorry.
I don't even have it.
Yes, so we do have the testing report that we get regularly from Minnesota Department of Health, and so the testing continues at the Vault testing site. And it's both saliva, the PCR testing, as well as the rapid tests. So we see that the last week of November 14th. So we had number of tests were 741, 758 the week before. So it continues to be utilized. I've had some comments from people that have been in for the rapid test, and 10 minutes they have the results. So it's a good opportunity for people to be able to get the rapid test. And they are, I unfortunately don't remember the dates or the days of the week they're open. Do you have that, Jamie?
I'm looking for it. But the one thing that has really been an asset is that they are open on Sundays now. So that was, families were looking for, can I test my child before they have to go to school on Monday? So that's been a real plus as well, so.
I think it's Friday, Saturday that they are not open, but they're open the rest of the days of the week. So, and you see the percentage, the positivity rate for each week. So, the week before it was 14.23%, now it's 12.45%. And we do know that you can see the Minnesota residents that get tested, but we're still accepting people from outside of, so from North Dakota mostly, that can come to our site and get tested as well.
Commissioner Kaylee.
I just looked up the hours so I can say
Thank you.
concretely what it says. That test site is open Monday, Tuesday, Wednesday, and Thursday from 11 to 6 p.m. and Sunday from 11 to 4 p.m.
Thank you.
While you're here, I want to shift gears for a minute and give a partial report of my committee report, and it dealt with the ARPA committee, and we had a brief discussion yesterday about the potential of this OSHA ruling that might come out from the federal government in regards to businesses over 100. And when we talk about this, we're simply talking about Clay County and our Clay County employees right now. And in the event that this were to go through, we had some discussions about, for those who, there's basically a couple of options that can happen. You can either can have the vaccine, or you can, if you chose not to do that, then it becomes a weekly test. And I believe, Darren, there is a third option where well, I think even under the third option, if they did that, they would still have to test. And that's where if they claim some sort of religious reason for not doing that. But I guess just for you, just to be thinking about and maybe be ready to report to us, because I'm looking more for, certainly we want to offer on-site. That's the discussions we've been having internally as a committee, that we want to be able to make sure our employees can be tested on site rather than have to. Now, obviously, there's some outlying facilities of ours that would probably have to come here, but I think the key thing, and we're going to be talking a little bit about this coming up, but the numbers and the number of test kits that we might have to have available for that type of thing. So all of those things. And the coordination of the weekly monitoring and the checklist of so there's going to need to be some cooperation from your department with that whole process. So just so you're aware that our ARPA committee has been discussing that, and we might be forced into that situation. And it's more of right now, just to keep that on your radar, that we might have to, and that might mean, staffing issues.
Right.
Having that available. Because we don't know what those numbers are, what percentage of our county employees are vaccinated versus not.
Right.
If this goes through, we will have to know that, so. Okay, does anybody else have anything for public health this morning?
So, Mr. Chair, just
Yes.
in response a little bit to that, I did order some test kits. So we have some in stock, just in anticipation that if we have to do this, we'll have some test kits available. I can't remember what the number is, how many we have, but, we can order more. But we have some at the ready, and of course, we're providing vaccines, so.
Right. And I know, Darren, maybe you can just give me a head nod, but it seems to me that ruling right now, as it was proposed by OSHA, would be for a 6-month time period. Okay. So we could potentially right now see if that were, and right now, if it wasn't for a judge's order to stop it right now, that would take effect as of January 4th.
Yeah.
January 4th. So in the event that judge's ruling is overturned, we need to be ready. So I'm just, hopefully you're,
We have been discussing some of that
all right. Good.
in the event that that would be required to have testing on site. And of course, the vaccinations will continue, so.
Yes. All right, Commissioner Kaylee.
Yesterday was Public Health Worker Thank You Day. Thank you to all of you, to your team. This has been a grueling marathon, and it's still going. I'm sorry, it's still going, but thank you. You are so appreciated, you are so respected, and the work you're doing is so important.
Thank you. We didn't quite make it to the White House to get an official thank you, because there was an event there, but we
Well, you
didn't
made it
quite
to the
make it.
courthouse.
Thank you very much.
Well, thank you.
Okay.
See you next week.
Thank you.